Hi, Facebook. My name's Dr. John A. Robinson.
And I'm Dr. Christina Bosch.
And we are euphemistically known, we are maybe notoriously known as...
the Sex Docs.
The Sex
The
Docs.
Sex Docs.
We're known as the Sex Docs. Oh. Is it? Now we don't even know if it... Can you see us?
Can anybody answer out there?
Well, there's a technical difficulty.
It's because it's such a cloudy day in Scottsdale that the whole world is disrupted.
Is that what it is?
I think so.
Oh, let me see if I can do this. This is sexy, right?
This is sexy.
Is this thyroid sexy?
Awesome. It's so important to have a handy person in the relationship. Not it.
Yeah. I don't know if I'm handy here, but we are live, that's for sure. And then, yes, Eva says, we see you.
Yay! Thanks, Eva. Here we go. Excellent. Well, welcome back.
Welcome back. Thank you.
So what are we talking about today?
Thyroid sexy today. And in fact, this is a 4-part series. We're really excited about this because this is launching some concepts about not just thyroid, but really what's going on with our new book coming out.
The Thyrosome.
The Thyrosome. Aptly named. That's just named after our system that we've developed over the past decade, and now finally bringing that forward as a book, something that I think patients will really be able to get their brains around. Mm-hmm. Our first book was over 500 pages. This is right around 140, so a lot more streamlined right into thyroid, something I think people will be able to easily digest. So this is just sort of celebrating that concept and starting to talk about thyroid and how maybe we can make it sexy for you.
Yeah, absolutely. And the thyroid definitely is sexy, so I think we should jump right into it. I wanted to comment that the reason it's 4 parts is because that's how strongly we feel about the involvement of the thyroid in your general health and especially in your sexual health. So let's dive right into it.
Well, let's start talking about the thyroid gland itself. And in fact, I think we've got a little picture here. Hopefully everybody can see this. So we'll get a little bit of the anatomy and about what the thyroid is about and where it's located. First of all, it's located in your neck. Mm-hmm. And maybe people know that, maybe they don't. But here it is, right here, right around the trachea. So it's pretty easy to feel, actually. You can feel these muscles right through here, and it's just on the inside. But it's a really small gland. There's not really all that much to it, right?
Yeah.
So you can kind of feel it in there. Some people are really good at feeling it. Other people aren't. In terms of physicians, sometimes you're pretty good at the whole palpation thing and finding things.
I think I get my little fingers in
Is
there
that what
really
it is?
well. But we don't have to rely, thankfully, on the skill of the practitioner. Your feedback, your symptoms mean a lot. And then, of course, we have some wonderful tools, which we'll talk about throughout these 4 sessions.
Yes.
But what about the anatomy do we want to point out?
Well, that first of all, this can get a little bit enlarged.
Yes.
One of the common conditions for thyroid, and in fact worldwide it's the most common condition for thyroid, is goiter as it relates to iodine deficiency normally worldwide. But here in the United States we probably see this enlargement of the thyroid, also known as goiter, from Hashimoto's or an autoimmune condition.
Mm-hmm. Now, and then with Hashimoto's, that's hypo or low functioning thyroid, where one can have a goiter in both hyper, high functioning, or hypo, low functioning thyroid concerns.
Yes. And you know what's interesting, a lot of times patients will come in saying they have a choking sensation, there's something kind of, they feel like something's stuck, they have difficulty swallowing, and that may or may not be with a palpable thyroid. And that's from the swelling that can go on from this autoimmune condition called Hashimoto's, or if it is hyperthyroid, that's known as Graves' disease. Either way, this inflammation from the autoimmune condition can cause a lot of that kind of sensation there for a lot of people. And what's interesting about that too, it even can go into the tongue. So some patients will actually say they feel a swelling sensation in the tongue that's part of the choking sensation. And some cadaver studies have actually shown that people actually have a little bit of thyroid. You can see where this thyroid is sitting way down here. Pieces of it can actually come up and get to the root of the tongue. The tongue does, at the root, go quite far back in your throat. But there can be some thyroid tissue will grow into that, and then if that thyroid then becomes swollen, connected to the tongue, it's a little bit...
You'll feel it. It'll bother you.
Right.
So some good take-home. I always like to give you some bullets in the middle while we're talking. Some of the take-home message here with just that component is that the anatomy of the thyroid can be complex to appreciate from an external aspect. So if you feel that you have this recurrent symptom of like, God, I feel like I just can't swallow well, or it must just be my allergies, we really want to always encourage you to check in with your physician and to ask them, do you think this is my thyroid? And if they have a tendency to blow it off and say, no, you probably just have nasal drip, then say, well, maybe we can run some tests.
Yes,
right?
And one of those tests might be an ultrasound. So like what Christina was saying, sometimes we can feel things with the thyroid, but I was a massage therapist for 14 years. I don't know if a lot of people know that.
And a very good one.
Yes, I appreciate that. But she's my only client now.
That's right, his only client.
But I got pretty good at feeling, anatomy. And when it comes to the thyroid, it can be a little bit deceptive. So an ultrasound, which is really, really simple, very uninvasive, it gives you a quick understanding on whether or not it's enlarged and what might be going on with the thyroid, physical sort of anatomy of the thyroid itself.
A thermograph would also be a great option for this. But again, this is why it's 4 parts, because I feel like we can talk just about this, and maybe we want to go a little bit more into the basics of symptom presentation, if there is. And for the sake of this talk, why don't we focus specifically on hypothyroidism, since it is more common?
It's far more common. In fact, it's about maybe over 90% of all thyroid dysfunction cases are low thyroid, and maybe right around 5 to 10% for high thyroid. So normally what we tend to see when patients walk in the door is hypo or low thyroid, which is resultant perhaps of an autoimmune condition, issues of nutrition, hormonal imbalances like low estrogen or testosterone can also influence the thyroid. And then you don't feel too sexy when you're feeling hypo or low thyroid. Yeah.
You can imagine if you're having hypothyroid, think of the thyroid as the captain of your metabolic ship. If you're thinking about metabolism and energy production, this is going to be literally the energy that I feel towards having sex, the energy that I feel towards working out so that I feel like I look good when I'm having sex, and libido.
Sure, yes.
Right?
And it's totally associated with libido, which I think a lot of it has to do with sort of wanting to get off the couch, or kind of the impetus of wanting to do things. But there's also a psychological component that goes on with what thyroid hormone is doing. It affects every single cell.
Aspect.
Yeah, right. So it could be affecting your brain, which is triggering certain centers to help you to have libido, or that psychological desire and drive to want to have sex.
Now, you've heard us say before that testosterone is involved in anxiety and depression. Is it not true to say that the thyroid as well is?
Absolutely. In fact, in psychiatric circles, they've been using thyroid hormone, particularly just plain T3, which is a certain type of thyroid hormone medication. They've been using that for years to help with all kinds of psychiatric conditions. So anxiety, depression, mood swings, irritability, kind of those basic things. So this is part of it. Because the thyroid is the great pretender, we say, it's got all these different things it affects, because it affects every single tissue, it affects every single symptom, at least in some way. So for sure, it's not going to make you feel too sexy if the thyroid is not optimized.
No, I mean, it's pretty safe from our perspective to feel like we can blame everything on the thyroid first. We literally will say it's guilty until otherwise proven. So we want to point out again in a very simplistic fashion, what are some of the common symptoms that will bring someone in the door that may encourage them to either give us a call, read the book, go to your doctor. What would be some of those symptoms?
Well, certainly
we've mentioned a few.
The fatigue. I think constipation is another really pathognomonic, we say. It's one of those key symptoms that are associated with it. It can be many things.
And let me ask you, John, can you please explain to our audience, what is a definition of constipation?
That's a great. So sometimes patients will come in and I'll say, "Are you constipated?" And they'll say, "No." I say, "You sure you're constipated?" No, I'm not constipated. I go every Sunday. The Sunday paper comes, the delivery boy, he delivers my Sunday paper. I go every Sunday. I'm very, very regular. And so obviously we know that's hopefully that's constipation. So if you're not going at least once a day, optimally might even be 2 to 3. Some argument is that with each meal you should be going, but at least once a day. You're constipated.
Right.
And so that can present in all kinds of forms, all kinds of ranges. Some people are going every 3rd day or 4th day, or in some cases once a week, or in some extreme cases even less than that. Yeah. And that could be from the lack of metabolism you get from thyroid, from the thyroid hormone that's coming out of this thyroid gland. Yeah. And that's not affecting then the motility or the movement of the gut.
And then if we're constipated, then we often find that we have other symptoms of indigestion or other diagnoses of digestive distress, like IBS or irritable bowel, or even things like Crohn's and celiac. They're all interrelated. And then from there you'll have weight gain, difficulty losing fat.
Yeah, staring at food and gaining weight.
Yeah. Yes. So the symptoms are really important for us. We want to really say, well, how is this gland related to me feeling sexy? What can I do about it? If you're suspicious that your thyroid is underactive, you want to talk to your physician about it. If you do not feel that your physician is doing a good enough job, then better inform yourself. We're here to help you do that, because then you can say, well, perhaps I am a subclinical presentation of hypothyroidism, right?
Yeah, subclinical meaning just under the radar. It might not be overly obvious. Sometimes blood work is or isn't very obvious, and so we call that subclinical. You've got a lot of the symptoms associated with it, or maybe not at all, but some of the key ones, and maybe labs are a certain kind of level of off, and then we've got some other tests. And in fact, throughout this series, we're going to be getting into some of the other cutting-edge tests that we have here that help to kind of catch those issues of low thyroid that perhaps maybe a general physician might miss.
So I hope that we've done a pretty good job of helping to understand from the basics of thyroid why we consider the thyroid to be so sexy. Sure. Because when that thyroid is fit, then you will be too. So let's evolve into let's evolve into how are we connecting this?
Well, let's talk about, we'll segue into this section that we do every week, the artisans of sex, the art and the science, the blend of the art and science together.
Yeah.
And so let's talk about the artisans of the thyroid and what that actually means. So we actually talked quite a bit about some of the science here, because we talked about a lot of the anatomy and some of those key things. But there is an art to this whole thing. Why some of the symptoms someone might be presenting with has a lot to do with this idea of your voice.
Of the voice, yeah. So if you can remember, more of that science component had to do with the actual anatomical location of your thyroid. There's symbolism in that as well. If your thyroid feels as if you are not swallowing well, or if your thyroid feels as if it is blocking your voice, literally your voice, then it is because also energetically and emotionally you may be having blocked voice. And the opposite of that is true. We will find that patients present with hypothyroidism when they are emotionally and mentally feeling as if they have suppressed emotions, or they don't feel that they're being heard by the world.
Right.
Now, this is the fifth chakra, which is the throat chakra, and the color of that is blue, which is also the color of thyroid cancer ribbon. So that's a nice, easy way to remember that. Blue is a beautiful color. Clearly, we represent it.
It's my favorite color.
It's John's favorite color, and we represent it in our logo for one of the many reasons. It's a divine color. It's a color of inspiration. It's also very specifically a color that represents good communication, and energetically it soothes the soul, which I think is one of the things you and I definitely find so appealing about it. And sexy. So when we're talking about the art of your thyroid and tying it back into sexy, speak your mind. Whether we say it coyly in the play talk that you whisper in your loved one's ear, or in the arousing talk that you have during moments of intimacy, or in simply understanding that a suppressed voice will not only suppress the quality and joy of your life and your sexuality, it can literally lead to pathology and disease of the thyroid.
Sure.
So on this artisan's note, we leave you with the concept of making sure that you feel well heard. And if you don't, whether it's an intangible or tangible solution, the Hormone Zone and the sex docs are here to help you do that.
Absolutely. I think maybe I have an idea. What if we did like some kind of exercise right now where you were feeling like you were heard. And let me say too, and I'm gonna say this to Christina because she's a woman. We see low thyroid 8 to 10 times more commonly in women than we do in men. That's just across the board in the United States. So we see more of this issue, and it could be maybe, as I'm a guy over here saying this and suggesting this, that maybe sometimes women feel like their voice is not heard, and that's one of perhaps the issues that many women struggle with out there. So do you have anything you might want to say to make sure we're keeping your thyroid sexy and healthy?
Okay. Well, for those fans of ours out there, you all know how much more private I am than Dr. John Robinson, so this is a little bit difficult to say in public. You know, it's something that we've talked about before. You don't love to hear it, but I really love when he wears stripes. And I find that summer's not just the season.
Really? And so so I wore this today for you.
And I say it jokingly, but not. I really love when he wears stripes. I think it's so handsome. And he doesn't particularly like it, so thank you for hearing me and for giving me an opportunity to speak my mind. And thank you out there for your support. I'd love to see those comments show up on our feed that you too love it when he wears stripes.
I'll wear it more if that's what you want me to do. I want everybody's voice to be heard,
yes,
particularly
indeed.
yours, my dear.
Thank you, my love.
Well,
let's do some.
We've got some other kind of housekeeping things.
Housekeeping.
Oh, and let me say this too, and I should have said this at the beginning of the video. Turn on your notifications. Remember that the sex docs are here for you every Tuesday, 12:30 Arizona time, Central Time. No, what is it called? Mountain time. Mountain time. 12:30 Arizona time. Every Tuesday.
Technology bloopers and all. We're here live.
No matter what. So turn on the notifications, and of course share the video. I had said that before. It was on the first page. Share this video so more people can get this great message about what we're offering here today. So we want to close in talking about an amazing event that's coming up.
So exciting.
It's called the Scottsdale Health Fair, and it's coming up this Saturday from 10 to 2, the day right before Mother's Day. Which we think is great. And we're going to have all kinds of speakers at this event, myself and Dr. Bosch included. We've got, gosh, who do we have? We have Connected Medical Center. Dr. Ross Dye, a chiropractor, will be there speaking. We have Jesse Holland from CrossFit Back on the Bar. He'll be there speaking, talking about, he's a movement specialist. Who else do we have speaking? We have Dr. Meghna Thanke from Second Nature Clinic, formerly Arizona. An Ayurvedic naturopathic medical doctor.
Very exciting.
Yes.
And then, we have many, but Doctors Diana Owens and Lori Handler, these are experts in sex therapy, in tantric healing, and other really exciting things. So we know that this is a local event, and we have a lot of wonderful viewers out there that are not local. It's always nice to take your mom out to a pretty weekend, but if not, reach out to us, and we may be able to organize some events closer to you as well.
Sure, but look. Here's one of the big reasons to show up. We're giving away a lot of stuff.
A lot.
So there are vendors there, so there'll be people speaking, and throughout the entire 4-hour time frame, but also we'll have other vendors there that are offering all kinds of things. And here's what we have so far. There's many things, but here's what we have so far. Yeah. Well, first of all, Connected Medical Center with Dr. Ross Dye. He's offering a wellness package of 12 free chiropractic visits. That is a $480 value. So we're going to have raffles throughout the entire time. It's not just going to be at one point. It'll be throughout the entire 4-hour time frame. So you've got all these opportunities to come and maybe win something and learn something at the very least about your health. What else do we have? We have Exos. Exos is a physical therapy and rehab place, awesome place. And they're going to be offering a 40-minute one-on-one movement evaluation.
Oh, that's nice.
Yeah, and a 20-minute, I'm really curious about this one because I don't really know too much about this one. It's a 20-minute Vasper hormone stimulation training experience. Ooh. I can imagine there's certain ways that you can actually increase testosterone growth hormone, and perhaps that's what they're talking about.
Like oxytocin we talked about last week. Oh, I'm putting my raffle in for that.
For sure. What else? So, integrated orthopedics, that's another speaker we have. Dr. Brian Gruber, he is a board-certified orthopedic surgeon who will also be talking about what it is that he does. And they've got a nice wine basket. That's
also,
always
and that's an aphrodisiac, which we'll get to in a future session.
Sure, and that's health food. So, and many other things. But with us, and we'll kind of say this is what we'll be offering here at the Hormone Zone. We have an RMR plus a 15-minute consult with either myself or Dr. Bosch. An RMR resting metabolic rate test. And in fact, next week we're going to talk a little bit more about how that relates to your thyroid. And that's a $200 value in and of itself. Then we have a mini grand prize of a micro pen and the Eclipse Dermal Rejuvenation System face kit. That altogether is a $300 value. And then finally the grand prize, this is kind of like the whole mother load here. We've got a doctor's visit, a couple of tests, poly-MVA injections, which is a wonderful nutritional injection.
As well as a voucher.
For $100 in supplements, altogether $445 as our grand prize. So a few things just coming from the Hormone Zone alone. And then many more, we'll share that as we go along.
For those of you who are already being seen by us, then great, we thank you. And what we would say is bring in your loved ones. This is a great opportunity to help segue them into this world of healthy living that you're so passionate about, that we're so passionate about, and that these vendors are definitely also so passionate about.
We're all passionate about serving the community, and that's exactly what the Scottsdale Health Fair is about. Serving the community is a free event. Come on by, come learn something, maybe win something. Win something for mom.
For mom. That's Saturday before Mother's Day, so this weekend coming up.
Yes.
10 to 2.
10 to 2. And come by and get some lunch. We have Cafe Pranzo there as well. They'll have lunch available for purchase. So we look forward to seeing you over that at Venue 8600. Check out www.scottsdalehealthfair.com for more information. scottsdalehealthfair.com. Here's what we definitely know for sure.
Hormones are sexy. The thyroid
is very sexy, yes. And we're the Sex Docs. We're here for you every Tuesday, 12:30 Arizona time. We'll see you next Tuesday.
Have a wonderful week.